So do you have fibroids, or do you know of a woman who has fibroids? If the answer is yes, then you are probably familiar with common symptoms of fibroid. Actually, it reminds me of a woman I care for who had problems with fibroids, and they were significantly impacting her quality of life. She had irregular periods, excessive painful periods that were heavy. Yes, she had pelvic pain, infertility, pelvic pressure, and she had pain with intercourse. Women with fibroids experience a number of symptoms, such as excessive bleeding, painful periods, pelvic pain, pelvic pressure, but also back pain, constipation, and fatigue from being anemic or iron deficient, painful intercourse, and some women have infertility, difficulty getting pregnant depending on the number, size, and location of the fibroids that she has. So in this video, I'll be answering the common questions that come up for women as it relates to fibroids, as it affects millions of women. Remember to like, share, and subscribe to my channel and hit that notification button so you'll be the first to see future videos like this. The big question is hysterectomy the only treatment for fibroids? The answer is no. And my goal today is to help you understand what fibroids are, why they occur, what treatment options are available, both non-surgical and surgical, and the importance of picking and choosing the right specialist to care for you if you have fibroids. So the first question that I get is, what are fibroids? And uterine fibroids are also known as leiomyomas. They are benign, meaning non-cancerous growths that develop within the muscular wall of the uterus. They are the most common pelvic tumor or pelvic growth in women, and they are influenced by estrogen and progesterone hormones that typically regulate a woman's menstrual cycle. Fibroids can vary in size from a few millimeters to several centimeters, and they can occur either by themselves singly or in clusters, and their location matters. Some mucosal fibroids, for example, grow into the cavity of the uterus, and they are responsible for heavy bleeding. Intramural fibroids grow within the wall of the uterus, and they can enlarge and cause the uterus to enlarge, causing pressure and pain. Subserosal fibroids, they grow on the outer wall of the uterus, and they may press on nearby organs such as the bladder or the bowel. Hence, some women can have frequency, other women can have constipation. So depending on these factors, women can experience very different symptoms with related to fibroids. So the next question is, who is most affected by fibroids? And it just so happens there are actually very interesting statistics when it comes to fibroids. African American women or Black women have the highest rates of uterine fibroids, and compared to Latin American women and Asian women and Caucasian women. Now, Latin American and Asian women have higher rates of fibroids compared to Caucasian or white women, but African American women have the highest rates. Fibroids are extremely common, and they affect 70 to 80% of women above the age of 50. However, as I mentioned, African American women are disproportionately more affected. Black women have 3 to 4 times, they are more likely to develop fibroids, and they tend to experience them at a younger age. They often have larger or more numerous growths compared to other racial or ethnic groups. Now, Latin American women and Asian women also have higher rates than white women, but they typically are less severe and their symptoms are less severe. There was a recent Atlanta Journal-Constitution article and a citing on some CDC data that found that African American or Black women in the southeast region of the country actually face higher rates of hysterectomy than any other group in the nation, with fibroids being the leading reason for that hysterectomy. And there are many reasons for this. There's first of all, a physician shortage of specialists who can care for fibroids and care for them in different various ways. And so a lot of women, especially African American women, end up having hysterectomies, whereas there's so many other options available for fibroids. And these discrepancies or disparities are widespread, unfortunately, and this is why education is so important. So why do fibroids occur is the next question. Well, the exact cause for fibroids is unclear, but there's several factors that contribute. There are hormonal factors, because fibroids are stimulated by estrogen hormone, progesterone hormone, and they often enlarge during a woman's reproductive years. There are genetic factors, because we know women who have fibroids have a higher likelihood of having other family members who have fibroids. There are lifestyle factors like high diets of red meat, low in fruits, vegetables, or vitamin D are also linked to fibroids, and obesity is actually linked to fibroids because of hormones. There are environmental factors, exposures to certain endocrine disrupting chemicals in personal care products or diet, exercise can cause fibroids. And we know fibroids can decrease or shrink in menopause. So what are some of the symptoms that women experience of fibroids? Well, it really depends on the size, number, and the location of fibroids, because women have common complaints like heavy or prolonged menstrual bleeding, pelvic pain, pressure, bloating, pain with intercourse, constipation, urinary frequency, fatigue due to iron deficiency anemia, or recurrent pregnancy loss or miscarriage due to fibroids. And these symptoms can significantly impair a woman's daily life, her relationships, and just her overall well-being. The next question is, so what are some of the non-surgical options that are available for women? Are there any natural solutions for women? Many women will ask, ask if there are ways to avoid surgery. And in many cases, yes, the answer is actually yes. We talked about those risk factors. There are certain lifestyle and dietary modifications that need to be in place that are beneficial, like maintaining an ideal body weight, avoiding obesity, increasing the intake of plant-based food, reducing red meat and fatty foods, and managing stress. All of these things may not remove the fibroids, but they will help to support a woman's natural hormones, and they can prevent the excessive growth or enlargement of the fibroids. Then the next question is, are there any medical options? And yes, there are certain medications that can be used to help to control the growth and size of the fibroids or the amount of bleeding. And these are tools such as hormone, either patches, hormone IUD, medications that can help to reduce the amount of bleeding. There are also other medications that can shrink the fibroid, and there's devices like a hormonal IUD that can help to reduce the amount of bleeding. However, these medications effects can be temporary. Some of them have quite a number of side effects, so that's something important to talk to your doctor about. Then the next question is, what are there non-surgical options for fibroids? And there actually are. There's procedures, uterine artery embolization, uterine fibroid embolization, endometrial ablation that can be used to control the bleeding and fibroids. Uterine fibroid embolization is performed by an interventional radiologist, and this procedure blocks the flow of fibroids, causing them to shrink. Radiofrequency ablation uses controlled energy to destroy the fibroid tissue through small laparoscopic incisions during a procedure. And endometrial ablation treats the lining of the uterus to help to prevent bleeding and excessive bleeding that happens with fibroids. So there are different ways that fibroids can be addressed in a non-surgical or a procedural option that is minimally invasive. And then lastly, the question that I'll get is, what are some of the surgical options for women? Why? Because some women may not benefit, or their symptoms may not go away. Fibroids may not shrink non-surgically, so they opt for a surgical option. So women with persistent symptoms, larger fibroids, fertility issues, surgery may be that next step. And it doesn't necessarily mean a hysterectomy, right? There's something actually called a myomectomy, which is a surgical removal of fibroids, but keeping the uterus, preserving the uterus. And this myomectomy can be done vaginally, laparoscopically, robotically. Again, keeping the uterus, just removing the fibroids. And so there's so many different options that women have with regards to fibroids. So fibroids don't just automatically mean hysterectomy. And there are non-surgical options, robotic surgery that can reduce the amount of pain, blood loss, scarring, incisions that women can benefit from. So I recall a woman that I took care of who had, again, she was struggling from fibroids, and she had tried lifestyle changes. She did the dietary modifications. She tried the medications. She did all the things, but her symptoms persisted. And then she did go see another physician who recommended an open abdominal hysterectomy, meaning removing the entire uterus to an open incision. And that would mean large incision, a lot more pain, blood loss, longer healing time. And she didn't want that. She wanted to preserve her uterus. She wanted to still have children. And she was looking for a minimally invasive option. So after researching online, she found my website, read my educational blogs, watched some of my YouTube videos that talk about robotic surgery. And then we met for a consultation. After she scheduled an appointment with me, we talked about a robotic myomectomy, where we talked about removing just the fibroids, keeping the uterus. And this can be done through very tiny incisions. And her procedure went beautifully. She had minimal pain. She was up and moving within 24 hours. She returned to work in 2 weeks. And more importantly, she kept her uterus. That gave her back a quality of life. So there are options aside from just a hysterectomy when it comes to fibroids. And so some of the advantages of minimally invasive surgery, compared to open surgery, robotic and laparoscopic surgery offer much smaller incisions, less pain, faster recovery, minimal blood loss, less scarring, less adhesions of scar tissue, and it can be done as an outpatient, meaning women can go home the same day and resume usual activities in a quicker period of time. The pain is typically mild, anywhere from 1 to 3 out of 10, not 8, 9, 10 out of 10 pain with an open incision. And a lot of women, again, are able to resume their usual activities within a few short weeks after surgery. So there are several options for women, even before getting to a surgery. And if it came to surgery, there are minimally invasive ways that can be done laparoscopically, vaginally, or robotically. So this woman I took care of, again, as I mentioned, she had tried multiple options, lifestyle changes, changing her diet, hoping that would help. She tried medications to help to shrink the fibroid and ease the bleeding, but that wasn't helpful enough. And while she really didn't want surgery, she knew that surgery was her next best step. So she did see a doctor who recommended an open hysterectomy through a major abdominal incision. However, she was looking for a minimally invasive approach. She found me online and scheduled an appointment to discuss the option of a robotic fibroid surgery or myomectomy, where only the fibroids are removed, as she really wanted to keep her uterus and have more children in the future. So she did some research online. She came across my website, and after binging on my blog, my YouTube channel videos, she decided to schedule an appointment with me to discuss robotic surgery of her fibroids, meaning a robotic myomectomy, where the fibroids alone are removed through a very tiny incisions and her uterus could be preserved. So during that visit, yes, we did talk about the advantages of minimally invasive robotic surgery compared to open surgery. And again, these advantages include small incisions that heal well, easier and faster recovery, minimizing external skin scarring and internal adhesions of scarring, much less pain, 1 to 3 out of 10, not 8, 9, 10 out of 10 pain. That's typically gone within 48 hours, much less blood loss, a quicker recovery. And I usually tell patients that recovery goes in stages, 2 days, 2 weeks, and then 2 months, where, within 2 days, able to drive, within 2 weeks, some women able to go back to work, and then within 2 months, able to resume all activities without restrictions. And she noticed improvement in bladder, bowel, and sexual function as a result. I definitely understand. Nobody wakes up in the morning and says, I want to have surgery. However, if you're a woman who's suffering from fibroids, know that you don't have to live or put up with it. There are good options, solutions available for you. So as a board-certified urogynecologist and reconstructive pelvic surgeon, I have helped thousands of women over the last 21 years improve their quality of life. And if non-surgical options have not helped you, surgery may be your next best solution to fix the problem of fibroids. Nowadays, surgeries are safe, they're effective, they're minimally invasive, and can be performed as an outpatient, meaning you get to go home the same day. And if you are looking for a specialist who specializes in minimally invasive robotic fibroid surgery, I invite you to work with me, Dr. Stephen Tugbiyele, board-certified, fellowship-trained urogynecologist, top doctor in Atlanta and Metro Atlanta. And the 2 ways you can reach me is one, through my website, that's drtugbiyele.com. It'll be in description and link in my bio, or call my office number at 770-292-4200. And remember to like, share, and subscribe to my channel and hit that notification button so that you'll be the first to see future videos like this. Leave a comment below. What other questions do you have about fibroids or about robotic myomectomy? Do you have a personal experience with fibroids where you perhaps were not told about all your options? Or did you have further questions that you would like me to answer? Be sure to circle back and answer those questions. But imagine how much better you'll feel when you no longer have to suffer with the symptoms of fibroids, excessive bleeding, painful periods, pelvic pressure, back pain, fatigue, anemia, constipation, painful intercourse, or difficulty getting pregnant due to the size, number, and location of your fibroids. And so, yes, while hysterectomy is common, it is not the only option for treating uterine fibroids. And if you're still struggling with symptoms and want to explore your options, again, I invite you to schedule a consultation with me. Visit drtugbiyele.com, complete the inquiry form on that website, and that my team will reach back out to you to schedule an appointment with me, or call 770-292-4200 to speak with my team in the office. Thankfully, modern medicine now offers effective, minimally invasive options that preserve the uterus and improve a woman's quality of life, comfort, and fertility options. And all of this is possible for you when you work with me. So I do invite you to work with me. And if you're looking for your gynecologist that you will trust, who will listen to you, explain to you all your options, you can schedule an appointment with me by visiting my website. That's www.drtugbiyele.com, or calling my office 770-292-4200. And I'll see you in the next video.